welcome everybody. Hi, my name is Trisha Zizumbo. I'm the Director of Training here at Oakland Community Health Network. Today I am bringing you Ian Unger, and my screen just went out over here, Ian, so I don't have your bio. So I'm going to let you go over that yourself when you unmute yourself. Ian is with Affirmations, and definitely want to welcome them and thank them for doing this webinar series this month during Pride Month. This will be recorded, and so it will be posted on our website probably within a week. We will be taking questions throughout, so I will ask you guys to use the chat feature that I will be monitoring, as well as the raise your hand button on Teams, so that Ian will be able to answer some of your questions as we go. So I will monitor both of those for you, Ian. So I am going to turn it over to you.
Great, thank you. My name is Ian Unger. I use he, him, his pronouns, and I work for Affirmations in Ferndale. We are an LGBTQ community center. I will go over a little bit more about Affirmations in the next couple slides, but some details about me. I personally identify as a transgender man, which means that when I was born, I was assigned female on my birth certificate, and I went through what's called the transition process to become who I am today. So through social transition of letting people know my name and pronouns, as well as some medical transition steps such as taking hormones, and then I had top surgery or my breast tissue removed, I now live full-time as a man the way that I navigate the world. And part of how I got into activism and doing the work that I do is a lot because I had a really positive coming out experience. So I definitely had some people who weren't happy with me coming out as trans, some of my extended family that I didn't really talk to, and then I had a couple friends that weren't okay with it. But for the most part, my dad, my immediate family, my really close friends were all super supportive. And I had a lot of friends that did not have that support when they came out, and I wanted to be that for them. So I got involved on my college campus. I dove into running their LGBTQ organization called Rainbow Alliance for Hope. I interned at their LGBTQ community center. And then after a little bit of time, I realized activism was what I wanted to do for a living. And I found Affirmations and actually moved to Michigan from Wisconsin to have this position. And now one of my main things that I enjoy doing at Affirmations is working with the youth. We've got several youth programs, but they are definitely our future, and they have a lot of really awesome things to say. So a little bit about Affirmations. Our mission is to provide a welcoming space where people of all sexual orientations, gender identities, and expressions and cultures can find support and unconditional acceptance, and where they can learn, grow, socialize, and feel safe. While our vision is to be an evolving community center where all who gather are embraced and are free to be their authentic selves. So while Affirmations programs and services are really focused on LGBTQ individuals, we are open to anybody, regardless of how they identify. We definitely welcome our allies into our programming, so everybody is welcome here. A little overview of some of our programming. I touched on a little bit the Youth Empowerment Program. There are two real main facets to it, and then a lot of other things we do as well. There is our Youth Leadership and Development Program, which is a curriculum-based program to teach self-advocacy and workforce development skills to youth ages 13 to 22. We traditionally meet in person, but unfortunately because of COVID-19 and everything going on, we've switched to virtual for pretty much all of these services, as well as our Youth Drop-In Center that typically meets Fridays and Saturdays from 4 to 9 p.m. for youth ages 13 to 18, but we actually have a Discord channel that we're using for the youth right now so that they can stay connected while we are closed for the virus. We have many other things for youth that we usually offer as well, ranging from a theater intensive to Pride Prom. We did a youth lock-in last winter, so we're hoping to do that again this winter. But yeah, lots of youth stuff. So support and discussion groups. We've got groups ranging from recovery groups. We've got AA, NA, Crystal Meth Anonymous. Many of those groups meet up to 7 days a week, which is really cool, and they're all meeting virtually right now. We've got trans groups, coming out groups, even just like gaming and social groups. So it's something for everybody. Health and wellness resources and counseling. We provide HIV and STD testing through our testing partners. Right now, of course, that is also limited. Pretty much everything I'm going to say right now is limited because of COVID. And then our counseling program, we're actually launching a telehealth portion to it so that our counseling interns who are under the supervision of an MSW who's on staff can still provide services when we can't meet in person, and also to expand to start serving individuals in rural communities that can't reach Affirmations. Diversity inclusion training, part of why I'm here today. We go out to businesses and organizations and talk about what it means to be inclusive of the LGBTQ community. And then many different social activities. We've been doing a lot of live streaming and stuff, so definitely check out our social media and our website. And then our recreation room and cyber cafe, when the center is open, are open for everyone. So for the first section, we're going to talk a little bit about identity definitions, the coming out process, and then what intersectionality and oppression mean briefly. So when we're talking about sexuality and sexual orientation, we're talking specifically about how somebody is physically attracted to somebody else. Your sexuality and sexual orientation is always a way that we self-identify. It's not necessarily based in the behaviors or the practices that we're engaging in, but instead how we perceive those engagements. And a lot of times sexuality and sexual orientation are very fluid. So for some people, they might identify one way for a large majority of their life and then later realize that that's different, and that's totally normal and acceptable. So with these terms, there are some that are probably pretty familiar, like lesbian, gay, bisexual, and heterosexual. But there are many, many different terms when it comes to sexual orientation. Some other terms that you might hear are pansexual, individuals who gender is not their primary source of attraction, or it's not as relevant to attraction as it is to other people. Asexual, individuals who feel limited to no sexual attraction. And demisexual is another term for individuals who may need to feel a romantic or intellectual connection before they can feel sexual attraction. So one of the most important things about sexuality and sexual orientation is being able to recognize that the definitions of these terms may be a little different for everybody, and we want to allow people to tell us how they identify. And also, if anyone ever uses a term that you're unsure of, it is okay to ask them, what does that term mean to you? Because it's better to not assume. We can't be expected to know all the terms that exist in the community because there are a lot. And also, I don't know why that keeps changing on its own. And also, it is just a really good way to validate to the individual that you care about how they identify specifically to themselves.
Ian,
So
can I
another
interrupt
term
you
that
for 1
you might
second?
encounter is queer. Did someone ask a question?
That's me, Ian. Can I interrupt you for 1 second?
Yeah.
We have a request if you can speak a little bit slower because our live captioning, it will make it skip.
Oh, okay. Yeah, I can definitely try to.
Thank you.
Yep. So another term that you might encounter is the term queer. And this is a term that is often considered a little bit controversial because it has been what's called reclaimed by the community. So the term queer really relies on the fact that while it used to be a derogatory term used against the community, a lot of individuals are now using it as a way to self-identify. Because it is a very open-ended term that is often used to describe individuals who don't identify with the heterosexual norm that people are expecting. So queer can be an identity. It can also be an umbrella term for the community. Queer is used in a lot of academic settings. So for some folks, you can study queer theory when you're in college. And queer is also used in political settings to really gain traction and attention regarding certain identities and such. So when you use the term queer, it often encourages people to really ask the questions. But queer is also a term that it's important to recognize that not everybody is comfortable with it. So not using this term unless you are part of the community or have been explicitly told this is how somebody identifies. So another concept that's important to understand is the concept of sex versus gender. So when we're talking about sex, we're talking about the biological characteristics that are assigned to a person based on their chromosomes and body type. Now, we usually think of sex as male and female because, as we learn, there's the XX and the XY chromosome combinations. But there are also other sexes that are assigned at birth, such as intersex, because there are different combinations outside of XX and XY for the chromosomes. Intersex is also individuals whose they may have sexual characteristics or body characteristics that do not fit what's particularly associated with male and female. So having those differences with their sexual characteristics. And sex shouldn't be confused with gender because gender is a way that individuals navigate the world, while sex, again, is those biological characteristics. So when we're talking about gender identity, we're talking about a person's perception on who they are as a person and how they define themselves. So gender identity really is about the self-perception. So for myself, I see myself as a man. That's how I present myself to the world. But it really focuses a lot on the expectations of how a person is supposed to behave based on their gender expression or identity. We usually hear this as man and woman, but gender is very much a spectrum with infinite types of expressions that are not easily defined. So for everybody today, however you're dressed, however you've done your hair, if you wear makeup or not, even your mannerisms fall into that gender expression. And it's also good to note that gender identity doesn't always align with gender expression. So for some folks, they may feel that they have a masculine gender identity, but might present themselves in what's considered more of a feminine way, vice versa. There might just be a very fluidity to that gender. But knowing that gender identity really is who the person is, and gender expression is how they show that. Another important information that you should know is transgender and non-binary identities as terms. So when we're talking about different gender identities, there are some different kind of umbrella terms that go along with that. One of them that some people don't really know is cisgender, and this is a term for a person whose sex and gender identity match kind of according to how it's expected by society. So this would be like an individual who is assigned female at birth and still identifies as a woman today. That would be somebody who is cisgender. Conversely, transgender is individuals like myself who have a gender identity that does not necessarily align with those societal expectations. So it very much is an umbrella term for a large array of identity categories. Two of them that you'll hear the most are transgender men and transgender women. So for myself, being a transgender man, it's good to note that however the transgender person is described, the term after transgender is how they currently identify. So because I identify as a transgender man, that means I currently identify as a man. So a transgender woman would be someone who currently identifies as a woman. And then there are also non-binary identities, which are gender identities or expressions that don't fit this traditional man and woman dichotomy. This can be an identity all on its own or also an umbrella term, because again, there are many, many terms to describe gender identities to kind of fit into just how vast of an array of identities that exist. So non-binary falls outside of the traditional man and woman. Transgender tends to be individuals who are kind of moving between the two, but can also be an umbrella term, including non-binary. And cisgender individuals who still identify with their sex assigned at birth. With trans and non-binary individuals, we might go through what's called the transition process. And this is a social and or medical term for aligning one's body and expression with your gender identity. So like I had kind of discussed a little bit before, when I first came out, that was the social part of the transition where I let people know my name is now Ian. I now use he, him pronouns, and I'd like to be respected as such. It's how we really start to navigate the world as our trans or non-binary identities. Then there is also the medical variety of transition, which is, again, taking hormones or having surgical interventions to really match one's body with their internal identity. Some trans and non-binary people may elect to have these procedures to confirm their identity, but others may not for many reasons. For some individuals, they just don't feel that a medical transition is necessary. It may not be a fit health-wise, just because with any sorts of medical procedures, there are always health risks. But also, accessing care for trans and non-binary individuals is often very difficult and very expensive. So many trans and non-binary folks are at an economic disadvantage to begin with because until just a few days ago, it was completely legal to discriminate based on gender identity, thanks to the Supreme Court. In employment practices, that's going to no longer be the case. But that economic disadvantage makes it really difficult. And many insurances don't cover hormone replacement therapy, so how to transition the body, as well as most insurances do not cover surgical interventions at all. They're considered elective procedures by many insurances. So it's important to note that it's completely acceptable to only socially transition or perhaps not even transition at all, because everybody's journey is different. Some people will feel at different places with their identities, and that is completely okay. So some notes on oppression. There are many different types of oppression that people experience, but two of the ones that we see the most frequently in the LGBTQ community are internalized oppression and institutional oppression. So internalized oppression often comes from the institutional oppression because the institutional are the rules and policies that keep a community from equality. They often stem from different religious and cultural beliefs that have been interwoven and just stay deeply seated in society. So regardless of any of the separations or the ways that legal procedures work, people still hold a lot of these beliefs and apply them to the individuals around them. Internalized oppression, conversely, is often from hearing all of these different institutional oppressions growing up, learning negative viewpoints of LGBTQ people, and then having those continue to resonate after coming out. It is really like a form of self-loathing, where we sometimes express that onto the community, even though we're a part of it as well. So LGBTQ people really need to unlearn all of those different oppressive thoughts to really embrace who they are as an individual. It's also really good to know that intersectionality is very much a reality in the LGBTQ community. And this is the concept that people who are LGBTQ are not simply LGBTQ. For people within this community, we often hold many different identities that often cause oppression, such as whether it's our race, our socioeconomic status, where we live and grow up, a religious status. All of these different cultural categories of discrimination can interact, making the marginalization much more complex and compounded. It becomes very much an exponential growth of the oppression that people experience, and it makes it that much more difficult to navigate. So when we're working with LGBTQ individuals, we have to remember to see everybody as their full self, not just one identity, and really acknowledge that everybody's experience is going to be different. So for the next category, I'm going to talk a little bit about the history of LGBTQ individuals in mental health care, kind of to help understand why many individuals who seek mental health assistance for LGBTQ identities are often kind of hesitant and wary about it. So some history of the DSM, the Diagnostic Journal for LGBTQ individuals within it. For same-sex attraction, in 1968, the first time we've really seen homosexuality within the DSM, it was listed as a mental disorder. In 1973, it got updated to sexual orientation disturbance. So it was seen as a disorder and something that was to be treated, not something that simply needs to be affirmed. But in 1987, homosexuality was removed from the DSM completely. It's no longer considered a disorder. Transgender identities, on the other hand, did not really come into the DSM until much later. So in 1952, there was a sexologist, Harry Benjamin, that reported what was the first official transsexualism case. So an individual who wanted to transition, specifically in this case, from male to female. In 1980, a gender identity disorder was added to the DSM after being used as a general term for decades. So when it was first added, it was considered a disorder based on somebody having a disconnect between the gender that they were assigned at birth and how they currently identify. This was kept in the DSM-4, but standardized into a single diagnosis. So gender identity disorder originally had many different layers to it, but then it became just kind of one overlying umbrella term. And in 2010, the DSM-5 reclassified gender identity disorder, or GID, to gender dysphoria. So instead of addressing it as something that's wrong with an individual, we instead are addressing what the actual issue is, and that's that body disconnect and the symptoms that come along with it, instead of it actually being a disorder to be a trans individual. Another point about the DSM and ways that individuals who are LGBTQ are still treated is conversion therapy. This was a lot more common back in the 70s and 80s, but it still takes place today. And in Michigan, it is still completely legal to do conversion therapy practices. And this is often a way to either try to convince somebody who's LGBTQ that they're not, or a way to kind of unscientifically get people to stop identifying as LGBTQ. One of the most common conversion therapy practices is shock therapy. So showing individuals homoerotic images and actually like giving them electric shocks to make them associate the homoerotic material with something negative. And it is a very dangerous practice. The HRC has cited that individuals who undergo conversion therapy are 8 times more likely to attempt suicide, 6 times more likely to have high levels of depression, 3 times more likely to use illegal drugs, and 3 times more likely to be at a high risk for HIV and STDs because of the shame that they begin to associate with being LGBTQ, and they may still be engaging in same-sex sex practices, but not be as aware or trying to hide it, so they're not being as careful about their identities. There are also other concerns that individuals face when seeking care. Some folks that I've talked to, these are all different individuals who have told me things about why they don't necessarily want to seek mental health care, ranging from they're afraid that they're going to get locked up if they say that they're feeling suicidal. A lot of times when people do go into inpatient or even just standard medical care, we get misgendered, or we're called our genders based on our sex assigned at birth, not based on who we are, which often increases those symptoms of depression and anxiety. So getting treatment sometimes actually makes the symptoms worse. Sometimes when people go to the doctor or to mental health care, partners are referred to as friends, even though there might even be a legal marriage. A lot of the more religious-based hospitals I've seen this happen in, but it does happen in the more like public, open-ended, secular hospitals as well. People make assumptions that somebody is straight. And I know for myself, one of the things I run into is people getting very confused, either asking me questions that are unrelated to the care that I'm receiving to find out more about my transition, or they make assumptions and they try to like change my gender marker because they think it's wrong because it says female, but I'm female on my insurance, which messes up my insurance, and just all sorts of other different assumptions that people make when people go in to seek care. So I think an important point with all of this is when you are providing services to LGBTQ people, understanding who they are from their perspective. So finding out if the person with them is their partner, finding out if their paperwork is correct simply by asking, like, is all of this correct? Because if somebody fills out paperwork and they say they're female but they're presenting as male, they probably did that on purpose. So just verifying that it's the correct information, and doing our best to refer to people how they want to be called. So getting the right name and pronoun. So asking somebody like, what is the name you'd like me to call you? Having an option for preferred names. Asking people their pronouns. So like when I introduced myself and I said that my name is Ian, I also said that my pronouns are he, him. That's a really good way to open the door for somebody to let you know what their correct gender pronouns are. Then a little bit more facts about being LGBTQ and mental health, some myths and misunderstandings about the community, and then some additional health and addiction concerns that our community often faces. So we definitely probably are aware that LGBTQ people face higher rates of mental health issues and struggles. But along with that, according to NAMI, LGBTQ individuals are almost 3 times more likely to experience a mental health condition. A lot of times we see this in the forms of depression and anxiety specifically, because a lot of the different stressors upon us from society. Suicide is one of the leading causes of death for LGBTQ people ages 10 to 24, only behind accidental death. And I think what a lot of people are probably aware of but don't really talk about is that, especially for youth, accidental death is a classifier used by the coroners for various reasons, but a lot of times things like overdoses are used in accidental death, or people who might have been self-harming is sometimes classified as accidental death, when in fact that is still a suicide. And 47% of transgender identified individuals attempt suicide at some point in their life. So almost 1 in 2 individuals who identify as trans or non-binary will feel pushed to the point of a suicide attempt. Another astounding fact from NAMI is that 20 to 30% of LGBTQ people abuse substances versus 9% of the general population. So substance use in the community as a coping mechanism is very, very common. And 57% of transgender identified individuals were rejected by their immediate family. One of the things that we don't talk a lot about, though, is when we see all of these negative statistics, is the positive. And there are a lot of studies that show that LGBTQ individuals are actually one of the most resilient categories of individuals, because when we look at different studies, having no support makes all of this very difficult. But a lot of LGBTQ individuals rely on their families of choice, or the individuals who accept them for who they are, regardless. And because of this, even just having one person who accepts you for your identity can make all the difference to all of this. So even being providers, if we're able to come to people and be able to provide competent care, or even just caring, a lot of times one of the things that makes a difference in care is being able to admit what you don't know, but also being able to educate yourself and not expect the LGBTQ individual to do all the education for you. So being here today and being on this webinar is really a great step towards that. Debunking some myths that a lot of people will sometimes say about LGBTQ people. One of the things that I've heard is that some folks think that transgender people are just confused gay people who want to transition so that they're straight, or other ideas of what's called trans trending, that this is somehow a popular thing to do. It's a way to get attention. But really, being transgender and a lot of the issues that come along with it, including a lot of the hatred, navigating a society where we're not considered of the same value as other people around us, it really isn't something that people take lightly. Very, very rarely does anybody ever do what's called detransition. It does happen, but like I said, it's very rare cases. And detransition is where somebody comes out as transgender, might start medical care or not, but then decides that they're not actually transgender, and significantly few cases there. Bisexuality is another identity that people often misunderstand. And this is one of those times where people think that bisexual people are just confused. You'll sometimes hear get off the fence. But bisexuality or pansexuality are just as valid as other identity labels for sexuality. It's simply that an individual might feel attraction to more than one gender. So, totally valid identity. Transgender people need therapy before they can truly identify as trans. My personal opinion is that transgender individuals should be in therapy because I think everybody should be in therapy, regardless of your identity. But really, the therapy that trans people need is not related to giving them their identity. It's related to how to navigate the world within that identity. Because a lot of transgender people know that they are trans. They know this from a very young age. They just might not have had language for it or have been in a circumstance where it was safe for them to come out. So now telling them that they need therapy to actually identify isn't actually going to make a difference. Like, you either are or you aren't. One of the common myths that people sometimes refer to is that you don't know you're not straight if you haven't tried being straight. We hear that a lot with people trying to say that being LGBTQ is wrong. But I definitely know a lot of straight people who haven't tried being gay. So again, we know our sexuality innately. And then going into what's going to be the next slide about health and addiction in the community is that some people in the community think that using substances, whatever that substance is just part of the culture because there is a very large bar scene. Historically, that's how LGBTQ people got to know each other. The party scene is also often very prevalent in LGBTQ culture. So just understanding that it doesn't have to be normalized to use substances.
Ian, we have a question in the chat.
Yeah.
Anna is asking, do you know if Affirmations will continue virtual services post-COVID to help with the accessibility to services? I work with youth and they are dependent on adults for transportation. Online services would help overcome this barrier.
Yes. Actually, one of the positive things about COVID for us is that we have been able to really jump not only into like present day technology, but really start looking at what virtual services can be going forward. So we're working on equipping some of our meeting rooms with basically like built-in Zoom technology so that we can have hybrid support and discussion groups. The youth Discord, I'm definitely going to keep that up and running so that even the youth who come and meet in person can still talk to other LGBTQ youth online pretty much whenever they want. Our recovery groups are definitely going to still have some online components. And then just seeing what else we can do virtually because, transportation to the center, especially for the youth, is often an issue. So we're going to really work on building up some of the technology to keep this going. Cool. Any other questions before I keep going?
Nope, that was it. I did notice we have a couple people on the phone. So I just wanted to remind them that if they have questions, it's *6 to unmute yourself.
Cool. Going into the statistics about addiction in the LGBTQ community, for those who aren't on the phone, you'll see a graph. The red bars are people who fall into the LGBTQ category, while the yellow bars are people who are considered the sexual majority or heterosexual. And you'll see that for any illicit drug use, it's more than double for LGBTQ people. So as you look through this, and this doesn't have alcohol on it, but alcoholism is also very prevalent in the LGBTQ community. So adults who are 18 and older in this community are significantly more likely to use cocaine. Heroin has an increase to it. Definitely hallucinogens, inhalants, and so on. Even prescription drug misuse is significantly higher than our straight counterparts. And again, this really comes down to we don't always have access to healthy coping mechanisms. Culturally competent therapy, finding a therapist who actually knows about LGBTQ identities can be really difficult. Accessing services for addiction can be really tricky. It's part of why Affirmations hosts so many recovery groups that we do, because a lot of recovery groups are very much based in religious practices, and historically LGBTQ people are not as welcome in those spaces. So having spaces where people in the community and their allies can come together and really support each other can help with the addiction component, but also just helping LGBTQ individuals gain access and knowledge to safer coping mechanisms outside of substance use. So the next step that I'm going to talk about is how to create spaces when we're working with clients to make them feel comfortable about being LGBTQ. So this is kind of the more way that we can respond to all of these things and help move away from the issues that we might be facing. So the first is talking about creating safe spaces. And a lot of times safe space gets a bad reputation because this is often a term that we hear thrown around in the media. We hear it as a concept where it's just an echo chamber or people can't talk about their beliefs, but this actually isn't the case. A safe space is a place where all backgrounds, identities, and life experiences can feel respected, regardless of personal opinions or societal norms. And it's a place for open dialogue and to feel supported. I've actually recently heard a term that I like better than safe spaces, and the concept is brave spaces. And these are spaces where we follow this concept of a safe space, where we're respecting people's backgrounds and identities, but we're also able to have hard conversations and really work towards a better environment and a more equitable environment by having those difficult conversations. So the idea of a brave space is that we really come together and share in the different things that we can do to become more equitable. So this could be talking about when there are issues within a space or somebody's feeling slighted, and really being able to have that constructive conversation. Some language that we often use in safe and brave spaces comes down to kind of removing gender from the terms that we're using. For a lot of reasons, we might refer to somebody's mother and father as their parents and guardians, because oftentimes these dynamics look different. And it doesn't always have to be about LGBTQ identities. Some people only have one parent. Some people might have same-sex parents. Other people might live with foster homes or different varieties of relatives. So just being respectful of that difference. Instead of referring to somebody's husband or wife, using terms such as partners, spouses, or significant others. That way we're not making assumptions about somebody's relationship dynamic. When I'm talking about gender identity, I've been using the phrase sex assigned at birth because, again, for intersex individuals, this sex category of male and female isn't always accurate because intersex is a valid sex that is assigned at birth, but especially with Michigan and many other states, it's not recognized on a birth certificate as a valid sex. So knowing that there might be those differences. If you're talking to a group of people, instead of saying like ladies and gentlemen or you guys, some of those more gendered phrases that we're used to, saying folks, friends, everyone, just those broader categories. When we're referring to clients as they, like, let's say they're coming in the door for intake or we're trying to identify somebody, referring to them as a person, a client, or an individual, because that way you're still referring to them as a person and a human being, but you're not necessarily assigning a gender to it. And if we're unsure of somebody's pronouns or they haven't revealed their pronouns to us, defaulting to they and them pronouns so that we're not making assumptions. This is one of the more nifty approaches to working with people who are gender diverse that I've found. And it's actually out of Iowa, which also surprised me because Iowa's not really known for their trans inclusion. But they created what's called the trans care approach. which are different points in the acronym of trans care for how to interact with our trans clients and patients. So for this, we want to treat transgender individuals with respect, as you would with all patients. We're not there to be your research material. Refer to transgender people by the name and pronouns associated with their gender identity and who they are. If you're unsure about this, ask politely. Never reveal a person's transgender status unless it's absolutely necessary for the care. Set a high standard for inclusive care. We want to be an example for those around us. Concentrating on care, not curiosity. So if somebody's trans status is unrelated to their care, it is not appropriate to ask about things like their genital status or if they've had any surgical interventions, unless surgery is applicable to the care that's being given. Doing our best to avoid negative facial reactions and offensive language. Sometimes, and it is kind of a normal human reaction, is that when somebody says that they're transgender, if we don't know this about the person, we might look a little bit surprised, but doing our best to not do that as much as possible. And educate yourselves and others about transgender healthcare and issues. Because it's great that I can come and speak to you all about the fact that these are things that we should pay attention to, but I can't talk to everybody. So being somebody who can say, hey, I think it's important that we adopt using gender-neutral language on our intake forms or using gender-neutral language at our front desks or when we're interacting with people. And then kind of to wrap it up, everybody can be an ally, but for me at least, I consider ally an identity that's earned. We don't self-define ourselves as allies. In the community, I'll often hear people talk about, well, so-and-so is a bad ally. And I don't believe that there's any such thing as a bad ally, because if somebody is claiming to be an ally, but they're being discriminatory to the community in one way or another, then they're not an ally. They're just somebody saying that they are. Ally is really an action term. It's for people who demonstrate the ability to stand up for LGBTQ people, whether this is stepping in when we hear people saying negative things about the community, encouraging others to use proper names and pronouns, self-educating and also helping educate the community, but also just being that support system. Because if you make a difference for one person, you are making a difference for the whole community. Allies can be straight or part of the LGBTQ community. We often define allies as straight allies, but if you are in the LGBTQ community, you can be an ally to different letters that don't fall into your own identity. So like for myself, as a white passing trans man, I can be an ally to my trans sisters of color, who often face significantly higher rates of violence and discrimination than I do. And allies are definitely there to lend their voices to the fight for equality. It's not always safe for an LGBTQ person to speak up about their identity. So really recognizing that there are times where allies need to speak up, and there are also times where allies can create a platform for LGBTQ folks to share their stories. So just kind of the resources that I used, and then I'll open it up for questions.
That was amazing. Thank you, Ian.
Yeah.
I did add the Affirmations website in the chat, and then I also found the website for the University of Iowa Trans Care approach and added that
Awesome.
website as well. So we'd like to open it up for questions. You can either use the raise your hand feature, or you can put it in the chat as well.
I'll just take that off.
I'll join you so you're not alone.
Thanks.
We have a question from Menachem.
Yes.
Hi, Ian. Thank you. I had a couple of questions, actually. So the first thing is, in the work that we do at OCHN, we work with a lot of individuals with severe mental illness and developmental disabilities who are living in very often group homes, self-determined arrangements, things like that. Can you talk a little bit about some of the experiences of individuals in those settings who are members of the LGBTQ community?
Yeah, and that can be very difficult. I have worked with a couple clients at Affirmations who have experienced those types of settings. And it really depends on the location. So I can't say this happens in all of them, but a lot of times situations like that, especially for trans and non-binary folks, can be very, very traumatic because you're often placed in the housing for your sex assigned at birth, regardless of your transition status. You're often referred to by whatever name is on your birth certificate and not really regarded for the identity that you are, because many places just simply don't have policies around preferred names. And because of that, a lot of times we're looking at what the most severe thing is that's going on. So obviously there's a reason that individuals are in group homes and things like that, because there are things that need to be treated. But oftentimes that's escalated by the fact that their identities aren't being respected. So just really understanding the way that mental health can be more difficult because somebody isn't having their identity affirmed.
All right. Thank you. And then the other thing is, as it relates, one of the things that some of us are involved in is the DEI committee at OCHN, and we're looking not only at the services we provide, but also in terms of how we interact with our colleagues. So what are some of the things we should be mindful of in terms of LGBTQ individuals in the workplace and how to make the workplace a more welcoming and safe place?
Yeah, and I think very similarly to kind of what I shared about creating safe spaces applies to workplaces. Really working on using that gender neutral language, being willing to have open and honest conversations around LGBTQ identities. So being somebody who is open to, if somebody says, like, if they identify as a man and they say my husband, really being aware of those reactions, knowing that we want to normalize the fact that there are many different variations to the way that people interact on that relationship level. And I think it really does come down to just showing that you're an ally. So that might be like having like a Pride Week within your organization. It might be having like a rainbow button or a sticker that shows that you are somebody who LGBTQ people can come and talk to. But just really kind of being open to those conversations and also being willing to accept feedback about how things can be better.
Thank
Great,
you.
thank you. Thank
Yeah.
you, Ian. We have a couple more questions in the chat, so I'm going to read one from Amy to you. I became aware of concerns regarding inpatient mental health hospital care when an individual who self-identified as transsexual. They were experiencing suicidal ideation, but did not want to go to the hospital because they did not feel safe about how they would be treated in the inpatient mental health setting. Are you aware of support or information about these needs or concerns in our area? Any information about how systems in our area are addressing this? Any other thoughts or perspectives?
Yes. So at least for like resources, it's difficult because of the organizations I've worked with in the area. It's why I brought up that oftentimes we're placed based on our legal sex, what's assigned at birth. I know that there are some in the area, like I believe Common Ground does individual rooms for individuals who identify as trans or non-binary and allow them to select what group, like when they do group sessions, which if they would prefer to be with women or men. But it's not standardized like that. I know a lot of different organizations in the area don't really necessarily have best practices yet, and it's not because they don't want to. I've talked to a lot of people who want to make those changes. It's just that there's a lot of different layers and also understandably a lot of safety issues that they are concerned about, more for the trans individual than for others. They definitely recognize the trans individual isn't the threat, but really working with a trans individual who needs that care, helping them navigate. Sometimes having a patient advocate can help a lot. because they can help the trans individual speak on what the needs are, especially when they're in a place where it's not safe to do so. And I also would consider reaching out to Transcend the Binary. They're a really awesome organization. They work really closely with Affirmations, and they do a lot of patient advocacy as well as trans-specific outreach to organizations to really get a network of providers who are safe for trans individuals to seek out.
Great, thank you, Ian. Any of these resources that you have, if you can send to me, I can make sure I can send out
Yep.
to everybody who's registered when we send an evaluation. We have more questions. So Tanya is asking, what is the criteria or process for individuals to participate in various programs offered by Affirmations?
Oh, that is a great question. Criteria is actually, we don't have a lot. Some of the support and discussion groups might be specific. So like transgender life support, obviously we would expect that you are either questioning your gender identity or identify as trans or non-binary. Our LGBT people of color group, you do need to be a person of color to be a part of that group to keep it a safe space. But pretty much all of our groups are open to anybody. Our recovery groups are open to anybody who needs recovery. Our coming out groups are for anybody who's kind of questioning their identity or want somebody to talk to about identity. And even like our gaming groups, we've got, when we're in person, we have a Magic the Gathering group that meets, and that's open to whoever wants to be a part of it. We really do accept and encourage whoever wants services to reach out, and we will do our best to help you navigate what would be best for you. And I should say, almost all of our services are provided entirely free. All of our support and discussion groups are free. Our counseling services are on sliding scale. So if people do need counseling services, we work with them if they don't have insurance. And even then, it's super low cost on that sliding scale. So.
All right, great, thank you. We have another question from Laverne. What suggestions do you have for providing assistance with individuals who are coming out?
The biggest thing is be a listening ear, asking the individuals what they need in regards to their coming out process. Some people might want assistance with coming out to other people and having you help with that. Other people might have just wanted somebody to confide in. Definitely, like we've been talking about, knowing the resources, so knowing about Affirmations, knowing that there are places that you can send people, and especially since we're going to be virtual, like the area doesn't really matter as much anymore, which is really cool. But just being willing to hear them for who they are and helping them if they need to find those services and navigate.
All right, great. The next question is from Tiana. I see you have your camera on. Do you want to unmute and ask your question?
Okay, sure. Excuse me. Okay, I work in, I'm an employee in Oasis. Y'all there? Y'all look stuck a little bit. But I'm an employee at Oasis, and my question is that how would, and I also identify as gay, how would we, or how would I, being that, maybe every now and again we'll get 2 to 3 people that are LGBTQ, how would I or go about informing my supervisor that I'm an ally as well as identify as gay?
Yeah, and actually, so now that the Supreme Court ruling came down, it changes how I would have answered this question, because now that in employment we can't be discriminated on for our identity, especially in the lines of work that we do. I think that's important because, like you said, you want to be able to identify you're an ally. I think if you have a good relationship with your supervisor, just being able to sit down with them and say, hey, this is how I identify. I know that we've got some clients that also identify this way, and I want you to know that I am an ally and I'm willing to work with them on these different situations they might encounter.
Okay, all right.
Great, thank you.
Thank you.
Thank you, Diana. We have another question from Anna. Do you have therapists at the center to work with youth, or are aware of any therapists in the community that specialize working with LGBTQ youth?
So Affirmations, unfortunately, we only serve 18 and up for our counseling services right now. But I know that the Ruth Ellis Center in Highland Park has youth specialist therapists. There is a therapist practice, I think it's in Bloomfield Hills. Natasha Kendall runs the practice. She has done a lot of work herself to become really informed, and she also has some LGBTQ folks who are hired to work with her. And then again, especially for the trans and non-binary community, I would say reaching out to Transcend the Binary and Stand with Trans. And like I said, I'll send all of these over to you so you can send these out. Stand with Trans does group support groups for both parents and youth. And then they do have a list of inclusive therapists as well.
Great, thank you. We have some more comments in the chat, but not so many questions. Menachem, do you have your hand up again, or is that still from before?
That's still from before, but you know I always have something I can say.
He does, he does. And all right, he didn't this time. Does anybody else have any additional questions? I just, again, want to, I did put in the chat, you probably have to scroll up a little bit now and I will repost it. We are doing a certificate of attendance for this. It's not CEUs, so I know I'll get that question, but we are doing a certificate of attendance. So I am going to put that in the chat again for you to fill out, and then I will be sending out an evaluation, sending out links and different things from Ian. But also want to welcome, again, if you're on the phone, *6 will unmute you. If you have questions that you want to ask, we have 30 minutes left in our time slot. So we are here to answer a lot of questions. Not all at once.
So I guess I can ask about training. So Ian, that's my primary role at OCHN is in terms of doing training, and we do recipient rights training and trauma-informed training and suicide intervention training. What are some of the blind spots that I should be aware of in terms of the experience of LGBTQ individuals coming to a training like that?
So for the LGBTQ folks who are coming to the training?
Yeah. So, yeah.
I think, again, a lot of the gender-based language, watch out for that, especially because a lot of times we use like male and female and like sex and gender interchangeably. And for trans and non-binary folks, that's definitely a sticking point, especially when we're talking about things that have to do with healthcare and mental health care. I would also say that recognizing that there are different dynamics for individuals in the community, something that doesn't come up a lot in conversation, is that many LGBTQ folks are maybe even not necessarily in a monogamous relationship. They might have multiple partners. So remembering that could be a part of the way that people are engaging in the world. And then a lot of times with trauma-informed care and such, remembering that many LGBTQ people have been subject to different trauma throughout their life, a lot because of their identity. So recognizing that there might be trigger points that you aren't aware of until they come up. So just being aware and perceptive of your audience.
Menachem always has the good questions. Oh, this is a question for me, Larissa. Will this be offered again or possible for you? Yes. So one, I hope to have Ian back again. He's coming back next week to talk more about gender identities and allyship. Both of them will be recorded. They will be posted on our website. And And yeah, I definitely would hope to have him back more. We were actually trying to have him back way in January, but it worked out great to be able to have him for Pride Month here as well. So this is definitely something as we increase our DEI efforts here at OCHN and being able to provide these kind of presentations and education and training opportunities for our network. So definitely we'll share that video with you. I will share you guys Ian's contact information. And so, yeah, we'll definitely try to have more of these type of webinars, but also ones on a specific topic as well. Any other questions? We still have about 40 of us on here.
Yeah, actually, I almost forgot that we tried to do this in January, but we hit a snow day. So it's snow days, pandemics. It's all right.
It's definitely something every month. Who knows what next month is going to bring us?
At this point, I don't know.
We're ready for it all. Well, if we don't have any additional questions, I'm going to give you guys back an extra 28 minutes in your day. Again, Ian, thank you so much. This is phenomenal. Always love to have you and have our conversations. So with that, I hopefully will see you guys next week at our second webinar in this series. When I send out the evaluation, I'll also send out the registration link for that as well. And then we'll end it here. So thank you again, Ian, so much.
Yeah, thank you.